A somber mood engulfed a village in Kenya's Rift Valley last week as dozens of medical interns joined other mourners at the burial of their colleague who had taken his own life. Speaker after speaker lamented the loss of Francis Nyuki, a 29-year-old trainee pharmacist whose family told the BBC about his feelings of exhaustion and frustration over the non-payment of his salary by the government since he started working as an intern in August. He is the fifth medic to kill themselves in Kenya in the last 2 months because of work stress hardships and lack of responsive insurance cover, according to Dr. Davji Atela, the secretary of the Kenya Medical Practitioners and Dentists Union, KMPDU, adding it was not something the union had ever recorded before. There had also been 5 attempted suicides by KMPDU members this year, the medical body said. No figures are yet available on the number of suicides nationwide in Kenya this year. Njuki was doing his internship at a public hospital in Thika town near the capital, Nairobi, when he took his life last month. He had reported hallucinations and depression due to sleep deprivation, his uncle Tyrus Njuki told BBC. In his suicide note, he mentioned that the 4-month salary delay was among issues that aggravated his mental illness, pushing him to end his life, the uncle added. The firstborn in his family, the intern had been battling depression and had been receiving treatment, according to a police report. Njuki was among hundreds of interns who were posted to health facilities in August to do their mandatory 1-year training to qualify. But the interns say they had not received their salaries for the first 4 months, with the government citing financial constraints. This is despite the fact that interns are a crucial part of the workforce in public hospitals, used by many Kenyans who cannot afford private medical insurance. Trainees make up about 30% of doctors in the state health sector. They do most of the work in public hospitals, but under close supervision. They are on call, sometimes for 36 hours, and provide most of the health services that patients need. Like many of his colleagues, Dr. Njuki faced insurmountable challenges in meeting basic needs, such as rent and utility bills, KMPDU said in a statement. The government has been in a long-running dispute with unions over the pay and working conditions of interns. The government has proposed cutting the monthly salary of interns to $540, £430. The union wants it to remain at $1,600, as had been agreed with the government in 2017. But President William Ruto has said that the government cannot afford to pay such an amount, and we must live within our means. We cannot continue to spend money we don't have, Ruto said in early April. Following mounting pressure and strike threats, the government last month released $7.4 million to pay more than 1,200 interns who had not received their salaries since August. Some of the interns say they are being paid peanuts. After spending 6 to 7 years of study, we had to wait for several months to get internship. And then with all the long working hours, the government decided to pay us peanuts. We are really suffering, Dr. Abdi Adau, an intern at Mbagathi Hospital in Nairobi, told the BBC. Dr. Adau is among hundreds of young medics who are torn between leaving the country to seek jobs overseas or abandoning their profession for better-paid careers. Another intern who spoke to the BBC on condition of anonymity for fear of reprisals said, "I have sworn to save life at the very least and restore health at the very best, but the government is doing everything to kill my zeal and undermine my oath of service." Experts point to the death last month of Dr. Timothy Riungu as an example of how stressful working conditions are for medics. He was a pediatrician at Kenyatta National Hospital in Nairobi, who collapsed and died at home after a round-the-clock shift. He had repeatedly complained of exhaustion to his supervisor that day, local media reported. The 35-year-old was diabetic and had not taken leave for the 2 years, according to his family. A post-mortem revealed Dr. Riungu had died of hypoglycemia, caused by the blood sugar level dropping below normal. It also showed he had not eaten anything for more than 48 hours prior to his death. In May, Kenya's government reached a deal with one medical union to end a 56-day strike, but the key issue of the salaries of interns remained unresolved. The strike had halted operations in public hospitals, with dozens of patients reportedly losing their lives. Several rounds of talks have collapsed over the pay and working conditions of interns. Last week, The KMPDU ordered all intern doctors to stay home as it issued a fresh 21-day nationwide strike notice, accusing the government of reneging on the agreement reached in May. Kindly like, subscribe, and share your thoughts in the comments section.